Have you ever felt like something is always stuck at the back of your throat? No matter how many times you clear it, the feeling keeps coming back.
Most people think it's just mucus, a seasonal allergy, or a simple infection. But what if the real reason is something completely different?
In this video, you'll discover the 3 most common causes of persistent throat mucus, why it refuses to go away, and what you can safely do to reduce it.
Let's begin with the first cause, one of the most overlooked reasons behind constant throat clearing: acid reflux, also known as GERD.
Many people believe acid reflux only causes heartburn, but that's not always true. In some people, it's
when stomach contents travel upward, they irritate the delicate lining of your throat. To protect itself, your body starts producing extra mucus.
That's why you may constantly feel the need to clear your throat, especially after eating, when bending over, or while lying down. If you also experience frequent burping, bloating, or a sour taste in your mouth, acid reflux could be contributing to the problem. The good news is that simple lifestyle changes can often make a big difference before the problem becomes more serious. Avoid eating large meals late at night. Stay upright for at least 2 hours after eating, and notice which foods make your symptoms worse.
If these symptoms continue for several weeks despite making these changes, it's important to speak with a healthcare professional instead of treating yourself repeatedly. Now let's move to the second cause. And this one surprises many people, because the mucus may not be coming from your throat at all.
Instead, it may be coming from your nose. This condition is known as post-nasal drip.
Your nose naturally produces mucus every day, and normally you swallow it without even noticing.
But allergies, viral infections, sinus irritation, dust, or pollution can cause your nose to produce much more mucus than usual.
Instead of draining normally, the mucus slowly trickles down the back of your throat, creating the feeling that something is constantly stuck there.
It can also trigger coughing, especially at night, because the mucus continues to collect while you're lying down. At this point, many people make a common mistake. They assume every throat problem is caused by bacteria, so they immediately start taking antibiotics. The reality is that antibiotics only work against bacterial infections. They do not treat viral infections, allergies, or acid reflux.
Using antibiotics when they are not needed can expose you to unnecessary side effects and also contribute to antibiotic resistance.
That's why antibiotics should only be taken when they are prescribed by a qualified healthcare professional. Now let's look at the third possible cause, and this one is hiding in your everyday environment. Dust, cigarette smoke, air pollution, strong perfumes, and even dry indoor air can constantly irritate the lining of your nose and throat.
To protect those sensitive tissues, your body responds by producing more mucus, even though there is no serious infection. If your symptoms become worse after cleaning your house, driving through traffic, or spending time in dusty places,
so what can you actually do to reduce this problem? Start with the basics. Drink enough water throughout the day, because well-hydrated mucus is thinner and much easier for your body to clear naturally.
If allergies are the cause, reducing your exposure to allergens and discussing treatment with your doctor can make a significant difference. If post-nasal drip is responsible, a saline nasal rinse may help remove excess mucus and wash away irritating particles. When using a nasal rinse, always use sterile, distilled, or previously boiled and cooled water to help reduce the risk of infection.
If acid reflux is contributing to your symptoms, avoid lying down immediately after meals and pay attention to foods that seem to trigger the problem. Small daily changes may not work overnight, but over time they can significantly reduce throat irritation and excessive mucus.
But before you assume it's just a harmless problem, there is something important you should know. If the mucus lasts for several weeks, contains blood, or is accompanied by difficulty swallowing, persistent fever, don't ignore these warning signs. They deserve proper medical evaluation instead of home treatment alone. The good news is that persistent throat mucus is often not caused by a serious disease. In many cases, it is simply your body's natural response to irritation, inflammation, allergies, or acid reflux.
The challenge is that many people focus only on getting rid of the mucus, while ignoring the real reason it keeps coming back.
And as long as the root cause remains untreated, the symptoms often continue to return.
That's why understanding the cause is far more important than chasing temporary relief. The heart circulates blood throughout the body, The red markers indicate the arteries carrying oxygen, while the blue represents the veins returning blood to the lungs.
Is the irritation coming from your stomach?
Is it coming from your nose? Or is your environment constantly irritating your throat without you realizing it? Once you identify the real cause, choosing the right treatment becomes much easier and much more effective. Your body is not trying to work against you. In many cases, this mucus is actually a protective response, not the problem itself. So instead of asking, "How do I stop the mucus?" start asking, "Why is my body producing it in the first place?" That one simple question can completely change the way you understand this condition.
If you found this video helpful and want more easy-to-understand, evidence-based health content, make sure you subscribe to the channel.
Thank you for watching. Take care of your health, and I'll see you in the next video.